Hello, good evening. I'm Priyanjali, your host for today's live from All About Skin Wellbeing team. I'm sure all of you must be keeping good health. Today, we are going to discuss our skin health with focus on psoriasis. Psoriasis, a condition in which skin cells build up and form scales and itchy, dry patches. Psoriasis is thought to be an immune system problem. Triggers include infection, stress, and cold. The most common symptom is a rash on the skin, but sometimes the rash involves the nails or joints. It can start at any age, but most often develops in adults between 20 and 30 years old and between 50 and 60 years old. It affects men and women equally. In today's digital world, it's a boon or blessing if we can get to hear from an expert dermatologist online about psoriasis and its types, how we can prevent it, and the kind of tests required for its diagnosis, the right treatment and management approach for an early relief. So, ladies and gentlemen, girls and boys, we have with us a renowned dermatologist of India, Dr. Arun Kumar. He is a dermatologist, cosmetologist, and hair transplant surgeon. He has done his MBBS from GMC Haldwani and MD from SGRRIMHS Dehradun. He has worked as a senior resident in Government Doon Medical College, Dehradun. Recently, he is providing his services at Skin Shine Clinic and Hair Transplant Center, Kashipur. A very warm welcome to Dr. Arun Kumar. It's a pleasure, Dr. Arun Kumar, to have you with us today as we are going to discuss about a very important topic, psoriasis. So, first of all, Doctor, I would like to ask you, what is psoriasis?
As you have told in a brief description that psoriasis is a chronic inflammatory condition which usually affect skin. In this disease, generally the metabolism of the dermis or the skin is increased. So more and more cells are formed which are usually not shut off easily. So it gets accumulated over the skin, and usually this disease starts by with a simple rash and which may progress to the plaques and sometimes to the erythrodermic psoriasis in untreated and long-standing cases. So basically, it is a disease which depends upon the immune system of the patients and later on develops into a widespread disease.
Right. Doctor, as we know that because the disease has to do with the skin, so also a lot of the confidence includes in that. What can be the causes of psoriasis?
So being on a disease which usually manifested due to the immune system of the body. Certain people are genetically predisposed to the certain conditions in a body, but there are certain triggering factors which may lead to the exacerbation of the disease. The main triggering factors are such as uh, certain infections, such as streptococcal infections, certain drugs such as beta blockers, ACE inhibitors. These are the drugs, and in a genetically predisposed person, stress is one of the main triggering factor which can trigger the disease. As it is not just an infectious disease which is transferred from one person to another. This never happens, but it is a disease which usually manifested in an individual due to genetic predisposition or an immune condition of the patient, which is triggered by certain triggering factor, as I told earlier.
Mhm. Doctor, a big matter to be concerned about. Uh, as we know that the causes is still unknown. Like we cannot particularly say that this can be the cause कि आप ये खाना बंद कर दो
Exactly,
तो ये हो
exactly.
सकता है. So now that we know that the causes is a little skeptic, we are a little skeptical to be, confirming about the cause. Who can usually get psoriasis? And as you already mentioned, it's not contagious. Any other thing we can maintain or do on a daily basis so that people around us cannot get spread by it?
As I said earlier, it is a genetically predisposed condition. Certain people are genetically predisposed. We can't change that. But with the treatment and with a healthy lifestyle, we can control the disease and we can get cured of this disease. So, in a day-to-day life, we can maintain a healthy lifestyle, such as having a healthy food behavior, having a regular workout, having a stress-free life, These are the things which not only helps us in psoriasis, but in other inflammatory and autoimmune conditions which are immune mediated. So if you wanna be just healthy, as we say, a healthy mind stays in a healthy body. Similarly,
Right.
a healthy body maintain your healthy mind. So these things are vice versa. So in an individual, it is important that an individual should maintain a healthy lifestyle, and and from a treatment point of view, nothing much is required if a patient is not having psoriasis. But once he is having psoriasis or psoriasiform conditions, then treatment is definitely needed. And in
Right.
day-to-day practice, we can usually have just apply moisturizers to maintain the skin hydration and nothing else.
Right. Doctor, for all the people who are definitely listening, maybe they know about the condition, maybe they have seen it, but it's not known to them. How does it occur? For them, how does the initial stage looks like usually?
Initially, it just starts with a red papular lesion. As you can see in gutted psoriasis, there is a variant of the psoriasis in which we see just a red color papular lesions over the skin, which generally spreads because patients not usually so much aware about the disease. Certain lesions appear over the skin. Then these lesions are mainly seen on the extensor aspect, so, and they start spreading. And after that, the lesions are like they are spreading and they increase, then it forms a plaque-like scales, some waxy and whitish scales form. They involve our extensor aspects, mainly our knees, elbows, and uh, legs, and in other variants, our hands and feet are also involved. So the initial lesions are generally रेड क्लब पेप्यूज, मतलब जिसको हम हिंदी में कहते हैं कि दाने से हो गए हैं शुरू में।
Right.
फिर उसमें
Right.
वो बढ़ते बढ़ते जैसे एक कहते हैं स्केल्स आर फॉर्म, प्लाक्स, जैसे हम भाषा में पूछते लोगों से, अच्छा पपड़ी तो नहीं बन रही है। दीज आर द रीजंस which are usually seen in the initial stages of psoriasis.
राइट। डॉक्टर, नॉर्मली स्किन प्रॉब्लम में ऐसा होता है कि हमें हम आइडेंटिफाई नहीं करते हैं, नहीं कर पाते हैं क्या चीज है। नॉर्मल रैशेस से हमें लगता है कि चलो कोई कीड़ा चला गया स्किन के ऊपर से, शायद इसीलिए किसी चीज में शायद रगड़ गया या कुछ खाना हमने गलत खा लिया, तो उसी चीज में उसको और बढ़ाते 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 वो एक खराब जगह चला जाता है। तो क्या सोरायसिस के केस में भी ऐसा है कि इनिशियल स्टेज में अगर हम आइडेंटिफाई कर ले तो क्योर क्या जल्दी मिल सकता है उसका?
As you said, initial stages पेशेंट ये सोचता है कि इसको कुछ रैशेस हो गए, कुछ हो गया है, दैट्स व्हाई वी नीड डॉक्टर्स. There
राइट,
comes the role of
एग्जैक्टली,
a doctor,
एग्जैक्टली।
है ना? Because to differentiate and making the diagnosis of a disease is very much important. Because whenever a patient is having some rashes, usually in our Indian scenario, and the patients are not so affording, and we are dealing with over-the-counter medicines. So patient usually purchase some ointment or tubes from local market or local medical shop
राइट,
and just apply it.
राइट,
And most of the time, they are not getting the proper treatment. So this is the main reason we are having such a huge amount of patients with advanced diseases. If the
राइट।
patient is consulting, if a patient consults in the initial stages, then with lesser amount of treatment and lesser amount of drugs, he can be easily treated in a
एग्जैक्टली।
lesser amount of time. So time is very important because the patient usually comes to a dermatologist in a very advanced disease, and at that time
राइट,
to uh, treat the disease is a bit uh, typical. So
राइट,
my advice is that the patient, whenever he or she gets a rash, he must consult his or her dermatologist to make the
राइट।
diagnosis and get a proper treatment.
राइट राइट, वेरी ट्रू डॉक्टर, वी टोटली बिलीव इट कि पहले स्टेज में ही आई थिंक अगर आप अपने शरीर में किसी भी प्रकार का चेंज अगर आप देख रहे हैं, हमारे एक्सपर्ट्स हमेशा आपके लिए मौजूद है टू हेल्प यू आउट, टू सजेस्ट यू द बेस्ट। तो घर बैठे उसका इलाज नहीं ढूंढ के जल्द से जल्द अपने नियरेस्ट एक्सपर्ट के पास जाए। डॉक्टर, एज वी आर स्पीकिंग अबाउट सोरायोसिस टुडे, इस चीज को क्या सबसे ज्यादा खराब कर सकता है या ज्यादा ट्रिगर कर सकता है? व्हाट कैन वर्सन इन द सिचुएशन?
As far as the triggering factor, there are two different things. First, what are the triggering factors which can initiate the disease? As I told you
राइट।
earlier, triggering factors are generally infections, mainly streptococcal infections, which are usually seen in sore throat and tonsillitis. Among the drugs, there are certain drugs such as beta blockers, ACE inhibitors, lithium. These are the certain drugs which can also trigger it. Stress. Stress is a thing which can trigger also, which can exacerbate also, which can increase the disease. These are the triggering factor. As far as things which can worsen the disease, जो disease को बढ़ा सकती हैं, ऐसी कुछ चीजें हैं, such as your food pattern. If the patient is not having good proper healthy diet, it can also affect the disease. Alcohol is one of the major factor responsible for worsening of the disease, because alcohol is just quite normal. Alcohol intake is quite normal nowadays, and alcohol is one of the factor which usually exacerbate the disease, and it worsens the condition. I have many patients who are alcoholic, and it is pretty difficult to treat them, because being an alcoholic, it's not so easy for them to lose alcohol from their daily life, and
राइट
in that
राइट।
condition, treatment is pretty difficult. And those patients who are just following the advice of his or her dermatologist and just abstaining themselves from taking alcohol, they are doing perfectly fine. So these are the things which can worsen. Apart from them, uh, sunlight, trauma. If there is trauma to the skin, it can also exacerbate the disease. So these are the only things which can. Apart from these, the things which can trigger, they can also worsen the condition. So
राइट
maintaining a healthy body, sorry, and a healthy mind is always required, because stress is one of the factor which can, if you are having a disease, it will create stress. Stress will
राइट।
again increase it. So it becomes a vicious cycle. So we need to break that vicious cycle so that the disease can be cured and treated.
Right. Just, doctor, just out of context, how can a normal human being reduce stress? Stress is such a wide term. और आजकल जैसे समय बीत रहा
Exactly,
है,
exactly. I got it. I got it.
इतना ज्यादा स्ट्रेस हो जा रहा है। इनफैक्ट आजकल हम बच्चों में भी देख रहे हैं जो कभी डिजीज हमने देखा नहीं कि अ, अ, जो बूढ़े या बुजुर्ग इंसानों को होता था, आजकल छोटे बच्चों को भी हो जा रहा है। इनफैक्ट प्रीमेच्योर ग्रेइंग ऑफ हेयर विच इज वेरी नॉर्मल, एक बहुत ही आम चीज, आजकल छोटे बच्चों को भी देख रहे हैं कि ग्रे हेयर। क्या कारण स्ट्रेस कहीं ना कहीं है, और अगर है तो इसे हम बैलेंस नॉर्मल कैसे कर सकते हैं?
See, as we are in a modern scenario, we are having more and more nuclear families. So
राइट।
we need to just have interaction with our family and friends, first of all. And interaction is required, because being in a metro city, living in a single apartment is quite a normal thing nowadays. But
राइट
living alone sometimes brings depression and stresses in an individual. It's not always, but it has been seen that the people which are living alone, they are facing these kind of situations. Apart from this, there are certain things you can do to maintain a healthy life and stress-free lifestyle, such as doing yoga, doing regular workout, and sometimes just take a break from your job and relax with your family and friends and family, and have some just move out for new places. These are the normal things which makes you
राइट
stress free, and there
राइट
is no drug which can make you stress free. So there is a lifestyle and changes in your day to day life which you have to make.
राइट। Well, doctor, I think a very good thing, and a great person once said कि it's के दिमाग में है। the way you train your body, the way you train your mind, that is the way how it works. uh, ऑल्सो सेल्फ टाइम, अपने आप को समय देना बहुत ज्यादा जरूरी हो गया है, जो आजकल के जमाने में हमें देखने को नहीं मिल रहा है. पीपल आर जस्ट रनिंग आफ्टर मनी एंड फेम एंड दैट्स ऑल व्हाट दे वांट इन today's world, but giving yourself time can solve half of your problems, I guess. Moving ahead with the topic, the reason why we are here today, doctor, we are talking about psoriasis. So coming back to the point, क्या सन किसी ना किसी तरीके से हेल्प कर सकता है सोरायसिस के बेहतर होने के प्रति, या कैन इट गेट अस हेल्प बेटर द सन?
Sun, yeah, sun can be a triggering factor, can be an exacerbating factor if it damages your skin, first of all. Because if it photo damages, then it can provide exacerbation or worsen the disease. But sun, as it is a bane, it can be turned into boon, because we can use sun in PUA phototherapy with solar
Mm-hmm.
and UVA and UVB rays, which usually comes from the sun. It can help us in treating the disease.
Right. Doctor, also has personal hygiene to do with psoriasis? Something which...
Perfectly, yeah, definitely. As psoriasis is a chronic inflammatory condition, so
Hmm.
skin barriers are just breached, and since skin which acts as a barrier in our body, it protects our body from outside environment, outside pathogens, to restrict them and not entering in our body. Since the barrier is breached, there are more and more chances that those microorganisms, those pathogens can easily enter the body. So we need to maintain a proper hygiene,
Right.
so that we can protect our inner environment from the outer infectious pathogens.
Right. Doctor, as you have already mentioned, psoriasis has a lot to do with our immunity as well. So, to increase our immunity, what normal diet should anybody follow?
No, it is not always required to increase your immunity. You have to just adjust your immunity with the environment and with the
Right.
geographical conditions. So it is not always to increase immunity. Yeah, we can. There are certain things we can do.
Mm-hmm.
There are certain omega 3 fatty acids, omega 369, which usually helps in the healing of the skin and maintaining the barrier of the skin. We can usually get, but taking medicines to increase your immunity is not so much required. You have to just adjust your immunity with the environment. And
Right.
in an immunocompromised person, that we have to go through and just give some supplements to maintain the immunity in the deficient person. If there is no deficiency, then there is no thing that we can extra should not be given to a patient to increase the immunity. If there is some deficiency in the body of a person, then it should be treated.
So, are we also saying, doctor, that some deficiency can also cause psoriasis?
No, I'm not saying that deficiency can cause psoriasis, but there is a relation. There is a
Right.
relation that certain deficiencies can worsen the condition.
Right. Right. Well, doctor, moving to the next question, our viewers would like to know, what is psoriatic arthritis? What can be what can be the situation in that scenario?
Listen, arthritis is an inflammatory condition of the joints.
Mm-hmm.
And the most common arthritis we are aware with is the rheumatic arthritis.
Right.
In day-to-day practice, we usually see rheumatic arthritis patient. So, psoriatic arthritis is different from rheumatic arthritis in that it is seronegative. It means in psoriatic arthritis, the individual is not positive for rheumatoid arthritis factor, but he or she is having the features of arthritis. Are you getting me? He is
Right.
seronegative.
Mm-hmm.
He is having seronegative inflammatory condition of the joints, and the pattern is that the joints which are mainly involved in psoriasis are the distal interphalangeal joints of the fingers and the axial body. These are the joints which are usually involved, and these are asymmetrical joints which are involved. And we can differentiate this from the rheumatic arthritis. So it is the manifestation of the psoriasis which usually involve joints. So it is known as psoriatic arthritis.
Right. Now that this topic has been clear, doctor, what organs affect psoriasis normally?
No organ affects okay, but psoriasis affects many organs. Psoriasis affects your heart. In ectodermic psoriasis, your heart is compromised, your uh, liver is compromised, your lungs are compromised, and in advanced diseases, your kidneys are also compromised. So the basic, uh, the main organs of the body, with the worsening of the disease, as more and more advancements in the disease, all these organs are simultaneously are affected.
Doctor, again, just out of the context, as we mentioned, the initial stage would be slight redness and itchiness and small dots. So, does this expand how laterally or inside the muscles? How does it expand
No, no, no,
normally?
no. It is usually spreading horizontally or laterally, but it is restricted to the skin and
Mm-hmm.
somewhat deeper. It doesn't go beyond the skin. The
Okay,
plaques and the lesions are restricted only to the skin. It never go deeper into the
right.
muscles or bones. It is not going to the arthritis in the bones is a different thing. It's not that
Okay,
it's not like that the disease is traveling from the skin to the bones. It's not like that. It it is a condition which is restricted to the joints and inflammation of the joints. So that is a different thing. And but the plaques are only restricted to the skin only. And in
Mm-hmm.
advanced cases, if there is trauma to that inflamed skin, then it can go deeper and infection can go down to the
Right.
muscles and joints. But
Right.
psoriasis is a condition in which the tattoos, the plaques, the scales, and all the lesions, the fissures, they are restricted to the skin only.
Right. Doctor, as you have already mentioned, it can occur in different parts of our body. So, according to your experience, what was the worst case so far you have seen?
Worst case, I would say the worst. There are different kinds of cases. If uh, if you get any kind of psoriasis in advance, it is a different. It is a difficult case. But
Right.
erythrodermic psoriasis is a condition where which is life threatening. Psoriasis
Mm-hmm.
is, as such is not life threatening, but erythrodermic psoriasis in which the 95 more than 90-95% of the body is inflamed, and in that condition it brings a very huge impact over the heart. So this is the condition which we need to be taken care of very precautiously and in consultation with the emergency and medicine department. So I think that is the most difficult part to treat.
So, doctor, how can that happen if we don't treat it at time?
Yeah. Ectodermal psoriasis is a disease. If we are not treating the disease with time, or sometimes the patient is negligent about the disease, or if the patient
Mm-hmm.
is not taking adequate treatment, the disease starts with a single papule and it goes on increasing and increasing and at last involving more than 90% of the body surface area. So it usually seen in negligent, non-treated cases.
Right. For all the viewers who are watching us right now, please do not take any of your conditions in your body, may it be skin, may it be internal functioning of your body. Do not take it lightly. As we are mentioning again and again, our experts are here to help you out. Doctor, again, speaking about psoriasis, which is the most usual part where we get to see its occurrence?
Most usual part, as I said, extensor aspects of the body and trunk.
Mm-hmm.
Extensor parts of our body are generally our knees, elbows, legs, and forearm, and on the trunk over the abdomen, chest, back. These are the most common area. Apart from that, uh, palms and soles, the skin of the hands and feet. They are
Right.
usually these are the most common areas which are involved, and scalp. Scalp psoriasis is the very most common entity which is associated with the psoriatic plaques in the body. So this is the most common variant, and these are the most common lesions appear on the skin. There is a huge classification, but this is the most common presentation.
Right. Doctor, before we move on to the viewers' questions, please let us know if if treated at time and if treated from the right person, of course, can this be cured totally?
Yeah, it can be. I won't say that can't be. It can be cured, but as it is an autoimmune inflammatory condition, there can be recurrences. But those recurrences can be managed easily and stopped from becoming a larger disease. So
Right.
treatment is necessary. If we take a proper adequate treatment, and once the disease is
Mhm.
suppressed, we need to maintain the hydration of the body and
Right.
just the moisture and hydration of the skin by proper and adequate moisturization.
Right. Well, now we'll quickly move on to the questions. I can see a lot of questions coming up from the viewers. Our first question is from Rahul Bastar. He asks, how can I manage the symptom of psoriasis, such as itching, redness, and scaling?
Uh, Three different things, and the most common thing is that the treatment, if he or she is having, so first of all, maintaining itching, a usual antihistaminic would do the work.
Mhm.
uh,
Mm.
as far as itching is concerned, along with some
Right.
moisturizer, emollient he is using. For the treatment of the redness and scaling, there are certain topical agents available with us, such as flumetazole salicylic preparations are there, and vitamin D analog calcipotriol preparations are there, which will usually help in the resolving of the disease. Along with that, to treat the scales, these combinations are more than enough, along with a humectant moisturizer, such as urea-based moisturizers are used in psoriasis to maintain the hydration of the skin. So
Right.
these things will be more than enough.
I believe, Rahul, you have got your answer. And again, because your condition can be a different from the rest of the people. So please go and get an expert advice. Once the person gets to see it, the solution becomes more clear. The next question comes from Rashmi Kohli. Rashmi asks, hello, doctor. Please tell us how to differentiate normal rash from psoriatic rash. It's a great talk in psoriasis, very enlightened. Thank you so much, Rashmi. Doctor, we'll move on with a question.
A normal rash, we need to differentiate it from a psoriatic rash. Being a dermatologist, I have the experience, I have the knowledge. I can just see and examine and look at it and say that it can be psoriasis or cannot be. But there are certain bedside tests or OPD tests we can easily differentiate. There are Cobner phenomenon is there, the task test, the auspice test. There are certain tests which can differentiate us from differentiate the disease. I would like to say sorry to Rashmi because uh, I can't teach it here how to differentiate, but she need to definitely go to a dermatologist to make the
Right.
diagnosis and differentiate the disease.
Right, right. Definitely, Rashmi, because it's skin. You never know what's behind it. It's the skin itself is such a vast subject. So, on the basis of your issue, you should definitely go and visit an expert. Uh, the next question comes from Ria Sati. Ria asks, can psoriasis lead to any other health complications? And if so, how can I prevent them?
Yes, psoriasis can lead to other health complications such as most common infections. Most
Mm-hmm.
common things are the infections. So maintain a hygiene, treat the disease. Once the skin barrier is maintained, you are through with the this condition. Secondly, it may affect, as I earlier said, as the sorry, as the skin barrier is breached, more and more hydration is lost from the body. It usually
Right.
affects the volume of the fluid in the body and affect the cardiac condition from the body. So maintain proper moisturization and proper hydration of the skin. It will help. Third, maintain a healthy lifestyle and a stress-free lifestyle, because psoriasis, if not treated adequately, and the patients with on and on long standing treatment, patients sometimes get stressful and with some mental issues. So just talk with your doctor, have a good consultation, spend time with your doctor, discuss it, and rule out your doubts, and so that there is nothing in there in your mind which can again bring us stress to increase the disease. So these are the things which can be brought up by the disease. So
Right.
just go through with all these and maintain a healthy lifestyle. You are through with the disease.
Right. Well, we always say this, that just few basic things in your life can be so helpful. Just doctor mentioned, having a healthy lifestyle and a stress free lifestyle, these are the basic things we need to take care of. Just stay away from the fancy external world, and you will see your life has become very much easier. Just yesterday I was watching a video, doctor. A person, a very known person, was mentioning this thing, that rather than screen time, enjoy green time. So that
Exactly,
can,
exactly,
right,
exactly. But
that itself
we are
can
so
be
much
so helpful.
we are
Right.
so much into our work. Most of the time we are spending on the screen. We just need a green
Exactly.
time.
Right. Riya Sathi, I believe you have got your answer. The next question comes from Pooja Sharma. Pooja asks, Doctor, are there any triggers or factors that worsen psoriasis symptoms?
Yeah, I already answered that in the
Right.
initial, but I'll again
Right.
answer that for Pooja. The certain trigger factor, infections. If you are having any infection, which can uh, most commonly sore throat infection, streptococcal tonsillitis, which is caused by streptococcal infections. So these can cause trigger certain drugs. Again, I'm telling beta blockers, lithium, ACE inhibitor. These are the drugs which can trigger the disease. Stress, as we have already discussed throughout
Right.
the meeting, and apart
Right.
from that, which can worsen, alcohol can worsen the disease. I have seen patients, I have treated patients, I have seen patients who are taking alcohol, they have got worsening of the psoriasis. And the patient who abstains themselves from psoriasis, they are perfectly treated. So
Hmm.
these are the things which can worsen the disease and trigger the disease.
Right. Doctor, just slightly slanting away from the questions coming up from the viewers, as you have already mentioned about alcohol, another common problem which the generation is suffering from is smoking. Does smoking also has to do something with psoriasis?
Yeah, definitely. Sorry, I forgot to mention that. Smoking. Yeah, smoking, as it hampers many metabolic activities in our body.
Right.
So, as it is an autoimmune inflammatory condition, smoking does trigger and does exacerbate. So, an individual who's having psoriasis, he must abstain himself from smoking. It is a quite a big thing I'm asking from smokers and who are having psoriasis. It is quite a big thing I'm
Right.
asking, but they need to evaluate their health and just need to abstain and stop smoking.
Right. Doctor, our next question is from Ria again. Ria asks, how is psoriasis diagnosed?
Diagnosis, most of the time, diagnosis is clinical. Means it is just we look at the disease and we say we see the lesions are papular, red erythematous, or scaly lesions having some waxy scales. We just make the diagnosis. If
Right.
we are clinically not sure, we just go for dermoscopy, and we are not sure with the dermoscopy, then we go for biopsy. And biopsy,
Mm-hmm.
most of the time we are just uh, pathologist gives us a report which help us a lot in diagnosing psoriasis.
Okay. Riya Sathi, that was your answer. And as we always say, that on the basis of your condition, the doctor will always, the expert will always suggest you the solution or the diagnosis. So the easier solution is visit your expert. The last
Exactly.
question comes from Shania Sen. She asks, are there any lifestyle changes such as diet or stress management that can help manage psoriasis?
Yeah, as I already told you,
Yes.
stress-free life, lifestyle changes, having food rich, good and maintained balanced diet, rich in omega 369 fatty acids, which we can get from. I'm not getting the name of that thing. We used to call that alsi in Hindi. It has a good quantity of omega-3 fatty acids. Along that, the fish oil, which can provide
Right.
omega-3, 6, 9. So these are the things which helps in maintaining the skin barrier and hydration of the body. So we can get these things, and abstaining ourselves from alcohol and smoking consumption, and having regular exercises, workout, yoga, meditation. All these things help in maintaining a free, healthy lifestyle and stress-free lifestyle. The thing depends what and how much you can do it.
Right.
So I'm not just saying that do it a whole day. Maintain and balance this with your daily life routine.
Well, that was all about psoriasis today. I believe almost all our questions has been answered in this session. I would like to thank Dr. Arun Kumar for joining us today and for, of course, your valuable time. It has been a very informative session as our viewers has also accepted that. I'm sure they will be using all those informations to prevent themselves from their and the near and dear ones from getting psoriasis. And in case if they get to see such symptoms, they know what to do instead of self medication. It's always better to visit your nearest dermatologist. Again, it was great to hear from you, doctor. We look forward to many more such sessions in the coming time with you and our viewers. And thank you, viewers, for your excellent participation in today's session. To get latest updates on how to keep your skin healthy, do like, follow our FB page, all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you. Stay safe and stay healthy.
Thank you.